Hi, welcome back to Whiteboard Wednesdays. This is Dr. Inkyong Parrack from Sarasota Vascular Surgery. We're here to talk about part one of the leg series. So we're going to be talking about three different things when it comes to lower extremities or legs. Part one is going to be about pain, which is today, which is about leg pain. We're going to have subsequent lectures on leg ulcers or wounds, as well as leg discoloration. So let's delve into leg pain. A lot of people come in saying, my leg hurts. What does this mean, right? The reason why I wanted to kind of talk about it in this way is people are not going to come and say, I have a blockage, I have a clot. That's not how most people come in. They're just going to come in and say, I have leg pain. Please help me with this. Well, leg pain comes from many different etiologies. There are some etiologies that are circulatory or blood flow in nature, which is what we do as vascular surgeons. But there are also going to be things that are musculoskeletal, meaning you may need the help of orthopedic doctors, or you may need help of rheumatologists, right? Or sometimes neurologists and PM&R doctors, which are rehab doctors when it comes to muscle. And then there's going to be the nervous system issues, meaning could it be a pinched nerve or could it be neuropathy? So there are many different causes of it. But today we're going to focus on circulation because when it comes to circulation, it can be an emergency. When you have a neuropathy or pinched nerve or some of these issues, a lot of times when it causes leg pain, you have time to try to figure it out and then determine what the best course is forward in order to fix the problem. When it comes to blood flow issues, it can represent blockages, both in the arterial as well as the venous system. And the two are very different. And some of them can be emergency right now. Some of them can mean emergency within the next week, or it could represent something a little bit more greater, meaning that if you have plaque disease in the legs enough to cause pain with walking, then some of these may represent that you have cardiovascular disease and other parts of your blood vessels that we have to worry about to maintain your health. So let's delve into what circulation means and go from the basics of the idea. So circulation is made up of two big parts, and most people get very confused in this. And I don't mean just, people who are not in medicine. I'm talking about everybody in general. The one big part is arteries, and then the other part is veins. And we do have to talk about both, and I do need to distinguish it, even though you don't need to come in to tell me what your problem is. We need to talk about it in the sense that we need to understand where we go from there. So when it comes to arteries, that's where when the heart pumps, the good oxygenated and nutrition-carrying blood comes out of the heart. Once it comes out, then it can go to the end organ, whether it be your brain or your guts, your kidneys, or your legs, to give it the adequate amount of nutrition and oxygen that it needs in order to supply that blood flow. So imagine when you have blood flow coming down to the legs and all the way from the heart. In theory, it's actually not that difficult. As long as your heart is pumping, right? That's one key ingredient. And then the second is as long as none of the roads are blocked, meaning that there's no atherosclerotic plaque, the blood is gonna get there. However, two things. One, if the heart is not pumping adequately, or if it is pumping with irregular rates, or when on the road all the way down to the feet, there are some blockages along the way, meaning it could be stenosis or complete 100% blockages from atherosclerotic plaque and plaque buildup. We can talk a little bit more about in a bit. Then you don't have enough oxygen and nutrition getting down to your legs. What does that feel like and what does that mean? So imagine if I were to go out there and start running a marathon. It's not going to go well. I don't run. And if the minute I start running, I'm going to feel kind of winded. But if I just kept pushing through, as we, a lot of times we want to do, I'm going to build up lactic acid in my muscles and I'm going to start to feel cramping and pain. The lactic acid conversion is because you don't have enough oxygen going down to your muscles. I'm not trained for it. But imagine that there's a lot of blockages along the way from your heart down to your legs. So now, even with just simply from getting from your house to the mailbox, which can be difficult for many of our patients, to their bodies, they're not getting enough oxygen to the big muscle groups on the leg. A lot of times, oftentimes, it can be in the gastrocnemius muscles, which are your large calf muscles. And because of that, then you can feel like you've just are trying to run a marathon just by trying to get down to the mailbox. So you get lactic acid buildup and you get that cramping sensation. That's not good. That means that your body is so starved for blood, it is crying for help, and something should be done about it. It's not always surgical, but you do need to know about it and that something should be done about it. And we'll address the therapies as well. Once the blood gets there, and let's say the blood gets there fine and you have no problems with it, is that the end, or can I still have leg pain? Yeah, because there's a second part of the circulation that we talked about, which are the veins. So veins are once all that good oxygen nutrition gets down to your feet or your legs or calf, wherever it needs to go, that blood now has to go back to the heart and the lungs. And you can think of it intuitively is not that easy. So one, there's no pump down in the legs like the heart. So there's nothing squeezing this blood to go back to the heart. And two, it has to fight gravity. And gravity is a real thing that you and I experience every day. And so trying to get that blood to go back against gravity all the way back to the heart and the lungs is actually not that easy. Our bodies do so by having these little one-way valves that flick the blood back, but invariably it's going to be slightly more stagnant than the blood coming down, which is forced down by the heart pushing it, meaning pumping it through, as well as long as you have a clean blood vessel, it's going to just go with gravity and go wherever it needs to go. So when that going back process is slightly sluggish in most people compared to the arteries, veins tend to be a side where the blood can coagulate or clot a little bit easier than the arterial side. So if you happen to have one of these, what we call hypercoagulable conditions, meaning your blood, not the blood vessels, but the actual component of the blood itself has either a genetic or acquired condition that makes it to become a bit more sticky and gelled together, then vein is the place where we usually routinely see a bit more of the clotting issues. And these are the sides when people say, I had a DVT or a blood clot in the leg. That's usually what people refer to. And then you may have heard of people who have PE or pulmonary embolism, meaning some part of that gunky blood that has coagulated down somewhere in your leg has then now broken off because things don't stay together in an organized manner, and it can slowly travel and go to where blood goes, which is the heart and the lungs, and then cause major issues. So leg pain may not be the most simple thing. Now that we kind of understand the circulation, I want to just go a little bit deeper into what each of the processes mean and how it can present and how we treat. So let's talk about the arteries. The typical presentation of arterial part of the circulation causing lower extremity issue is pain with walking. That's what people usually come with. They say, you know what, doc, every time I get up and I start to walk, my butt really hurts. And I've had some patients who come in and they're too embarrassed to talk about it because you almost sound not normal when you say my butt hurts with walking. It's because the glute muscles are a huge muscle group and it requires significant amount of oxygen nutrition in order to fuel it. The next big muscle group where we have this type of an issue is the gastrocnemius, or your calf muscles. So your calf muscles also starve for blood if not enough nutrition and oxygen is there, and you can feel cramping in either the glutes or in your calf muscles. And this basically means there's some sort of blockage above the muscle group. So if there's a blockage somewhere in this area, and this is where our natural groin creases. And so if there is blockage or a little bit of stenosis because of plaque buildup, then you can have lack of blood flow going into the subsequent or lower down or more distal muscle group, which would be the glutes. And so if the blockage is on the left side, every time you walk, you're going to have that aching pain, lactic acid sensation on the left side of the body in your glute area. Now, if your blockage is not up here, but the blockage is somewhere down here below your groin crease, in the arteries that feed at the level of the thigh above the knee or just right around the knee, then the blood flow to your calf muscles are going to be compromised. So this is not if we happen to find some blockages all the way down in the calf. I mean, it can cause issues, but we have, as you can see, 3 different arteries down there. So losing one usually is not a huge deal. But if you have total blockage in this area, that's going to cause lack of blood flow to your calf muscles, and then every time you walk, and it usually is like clockwork for most people. They say at 100 yards, or if I walk to the end of the block, then I start to have pain. It is because our bodies know it can only have so much energy and so much nutrition and oxygen before it starts to build up that lactic acid. So it's going to be like clockwork. And if that happens, you should probably be suspecting there's some sort of blockage or plaque buildup in your body. But let's say you don't have adequate blood flow. You come in, you tell me that you're having these issues. What can I do for you? The things that we can do are, some of it is medical, meaning we're going to optimize your nutritional status. We're going to optimize your exercise status, meaning we're going to give your body the best fighting chance to be able to make these collaterals so that you can, one, avoid surgery, and two, you can have a lasting outcome without any prosthetics in your body to be able to walk and do the things that you like to do. If that's not possible with maximizing your body's potential to build these extra pathways is not quite enough to get you to where you need to be, and you're still having issues cooking at home, just trying to do your laundry or get to the mailbox, then we need to do the next step. The next step is basically either boring through the parts that have plaque disease. So we recreate that channel. We take away that plaque so that your blood flow is restored. Or sometimes if that's not possible, we can even bypass it. And you've heard of people getting, I had a quadruple or triple bypass in the heart. It's the exact same thing you do on the legs, meaning if there are blockages here, then I can go from a clean area to another clean area and bypass and go around the area that has the blockage. So that's the arterial system kind of in a short. And we're going to end with the venous system in terms of what the venous pain is and what we can do for you. So if your leg hurts from the venous congestion, meaning now the problem is the blood flow going back to the heart and the lungs, then what we can do is do some ultrasound studies to, one, see if there are any blood clots or evidence of blood clots, because old clots usually leave these kind of fibrotic shell inside the vein. And so the vein, which is supposed to be nice and pliable, no longer is pliable. And we can see that a lot of times on imaging. So we can look for clots or evidence of old clots. And then two, we can then look for how the function of the veins are. So we talked about how it's very difficult to carry blood against gravity without a pump from the feet all the way back to the heart and the lungs. So in order to do that, we talked about these tiny little one-way valves. If those valves are overworked over time or then becomes floppy, then you're not going to have adequate blood flow going back. If that's the case, then your leg becomes congested, swollen, and some people tell me that their leg feels so heavy and tight, they feel like they're dragging their legs, and that's the sensation of pain that they get, which is very different from that acid burning pain. So if that's the case and you have congestion in the legs, then we can do things to maximize your pumping potential coming from below, which is pumping at the calf muscle. If that's not adequate, there are some even supplements that we recommend in order to boost that venous return. And then lastly, we also can maximize the veins that are working, because we have many, many veins down in the legs. Usually the ones that are malfunctioning are superficial veins, and we can actually not be dependent on that and make sure that all the good blood is rerouted toward the veins that are working, which are the deep veins. So these are some of the things we can do for congestion. If you have a blood clot, then obviously it needs a blood thinner. And you've heard of a lot of people being on medications such as Coumadin, / warfarin, or Eliquis or Xarelto. These are some really strong blood thinners that can help, prevent some of the clot from getting worse and worse, and then concern for breaking up and going to the heart and lungs and causing major issues such as chest pain, shortness of breath, and difficulties. So there are medications as well as surgical methods for both sides, in the arterial side as well as the venous side. And circulation is essentially very important, and we need to catch it when we need to figure it out. So if you have leg pain, let's figure it out, whether it comes from the blood flow or the circulation. And if it is, then we'll get you fixed. This is Dr. Inkyong Parrack. Thank you for joining me on part 1 of Lower Extremity series.